So Paula's going to talk to you about that and the sort of the things that we've got to look out for this time round. After that, Ian Wells from Dorset Council is going to talk about the new fund that has become available for this month and this month only. After that, we've got Vicky Oliver from Volunteer Centre Dorset, who's going to talk about volunteering in the winter and loneliness and isolation. And then after that, if we've got time, we'll go on to the funding alerts. If we find we're running out of time, then we will post the funding alert slides up onto the website afterwards. So, welcome again, and off we go with Paula. Morning, Paula.
Good morning, everybody. I'm just going to share my screen, so bear with me. So hopefully that you can all see those. Joe, if you can give me a thumbs up if they're visible to everybody else. It's always one of those disconcerting things where you know that you can see them, you just don't know whether everybody else can. So the regulations were uploaded yesterday evening. So as you can imagine, it's been a bit of a whistle tour for me to go through them before delivering today. As a result of this very significant change to the guidance around COVID-19, we're actually going to be doing another webinar next Wednesday, just a short one, just to be able to go through this guidance in a little bit more detail. And also we will of course receive questions from yourselves in the chat bar, which if you would like to do today, please do put in any questions that you've got. And we'll also receive them through our helpline and through our inquiry line, and that will inform the way in which we will put together the presentation for next week. So on this first slide, and these slides will be available on our website after today's presentation, because there is only really time this morning to do a very whistle through. So links to the guidance, which is the kind of easy read government version. I use the term easy read with advisement, but it is easier to go through than the actual legislation itself. But of course, the legislation is where you find the nitty gritty around the rules and restrictions. So to be honest, it is worth having a look at the regulations, but I would advise everybody to start with the guidance. So now I click and I hope something happens. There we go. So the first bit really, which is quite important, I think, is section 4. And section 4 is closure of restrictions on businesses. And section 18, subsection 9, this is where legislation gets fun, talks about explicitly community centres and halls, which of course would include village halls. It's not a surprise to us that they're going to be part of the closure, that they are being asked to close. I think what's a little bit different this time is that there are some exceptions. One of the most significant is the allowing of support groups to continue. During the first shutdown, what we saw was an awful lot of people who normally received help in a face-to-face environment in a support group, finding themselves struggling to access online support in the same way. And that can be really, really difficult for people. So as a result, they actually have put in an exemption around support groups. So that exception, which comes in part 3, which of course is always very weird when you're jumping upwards within restrictions, but part 3 is about restrictions on gatherings, so it does make sense it fits in there. So what is a support group? Well, a support group consists of no more than 15 people. And it can't take place in a private dwelling. So that's why we need to have some access to village halls and community centres for these support groups. I think probably the caveat that's there, and this is going to be for the hirer to decide, not for you, is whether actually it is reasonably necessary for members to meet together. Now, groups that use high anonymity, and I would probably put AA and other drug services within that, it often is a lot more comfortable for people to meet face-to-face than it is online. So it would be reasonably necessary to meet in a group. For support that's offered, particularly for young people in a one-to-one environment, again, it's working better, still meeting one-to-one in face rather than online. And also mental health support services around things like bereavement can be most effective when they're one-to-one and they're in face-to-face. So it is going to be down to the hirer to go back to their organisation to see whether their organisation will support them to be open during this time. So whether they can be open is not down to you, it is down to the hirer to make that decision based on their risk assessment and the guidance from their guiding organisation. What you'll need to do is whether your risk assessment will make it possible for you to be able to make your premises COVID secure enough for them to be able to operate out of your premises. And we're going to talk about guidance around clinically extremely vulnerable people and clinically vulnerable people in just a short time. And that might have a bearing on your volunteers and the people that you've got that can support you. So in a little bit more detail about what constitutes a support group, they've actually given some examples. Now, from reading of the guidance, these would seem to be examples, and I think it clearly says actually in the legislation that they're examples. So it's not an exhaustive list, but I think it does give a good flavour of the kind of activities which would still be allowed. So they're not social by nature. So this isn't the Whisk Drive, this isn't a knit and natter group. This is something that actually is offering benevolent support to a group. And I think that the examples that they've given kind of categorise that. Remember, it is the hirer's responsibility, if they want to approach you, to come to you and say, we'd like to still operate our support group. More general exceptions is probably worth mentioning, which is still part of part 3, social gatherings, but it does talk explicitly in here about it is reasonable for people to gather in the provision of voluntary and charitable services, and that is within work purpose. So that doesn't mean that all charitable and voluntary services can continue to work as a group. It's talking about it in the context of work. So if you are a charitable organisation like DCA, we can still continue to go about our business because we come under that heading of work purposes. So if my team needed to come into the office, for example, that would be permissible under work purposes. But it doesn't necessarily mean that all charitable services can remain open. So it is difficult to pick apart, but it is important to see some of those distinctions. But it does clearly state later on in the guidance about volunteering, and that volunteering for the benefit of others in the community is a permissible activity. So you can be out and about during lockdown providing volunteering services for other people in the community, whether that's collecting shopping or whatever it might be. It's worth noting that within services that are allowed to operate now, medical services are still all operational, including dentistry. For any of you that's been struggling to see a dentist, you might be surprised by that, but they are still operational, but of course working within very tight COVID-19 restrictions. There's a really big push that if you need to access medical services, you should still do so, and you should still meet any appointments that are sent to you. Pharmacists will also have a legal duty to deliver prescriptions. So that should be something now that falls to the remit of pharmacists. They can still access Volunteer Centre Dorset, Age UK, and the national NHS volunteer responders if they want support with that, but they do have a duty to deliver. This is the main guidance. So regulation 15, this is at the end of the regulations, which does go through the businesses in more detail. So it does highlight museums, galleries. It does talk about fitness centres, gyms. So it does go into more detail about those businesses that have to close. And it also gives a little bit more detail around essential services and what that means about them being open. You'll notice that I have put on there the page number, so it does make it a little bit easier to flick through the legislation, but it's not that long. It's about 32 pages, I think. So I mentioned before about what we previously called shielding. And the term shielding is not being used anymore, although I did note that on the government guidance, they still had the word in there. So that is likely to cause a little bit of confusion, but you won't hear amongst council officials or the NHS the use of the word shielding. And that's because what's happening this lockdown is very, very differently, marked differently to the first lockdown. So there isn't going to be a group of people who are going to be told to remain at home. But the clinically extremely vulnerable group, which is the same group that were counted before as shielding, are being told to stay at home as much as possible. So they are still able to go outside for exercise. They would be able to go out to get food and provisions while keeping themselves as safe as possible. And they would still be able to attend medical appointments. So it's not shielding, and that's why we're not using the term shielding, because it isn't. But they are being advised to stay at home as much as possible. Now, there is a list, and if you click on the clinically extremely vulnerable link, you'll actually get a list of people who fall under that heading. But it's really important to differentiate between people who are clinically vulnerable and the extremely vulnerable. So clinically vulnerable are anybody over 70 with some health conditions. The clinically extremely vulnerable are people with health conditions that would put them at a very, very high risk. To give you a kind of example of what I mean, it means things like people who are transplant recipients, people with very specific cancers, people with chronic and severe respiratory conditions, such as chronic obstructive pulmonary disease, people with rare diseases that make them much more susceptible to infections, adults with Down syndrome, and women who are pregnant who have significant heart disease or congenital heart conditions. So it's a very, very specific list. If you are somebody who has any of those conditions, or anybody that you're supporting does, it's really important to know that you will be written to. And those letters are going out very, very shortly. And those letters will detail support that is available to you, and also the guidance that is recommended if you are clinically extremely vulnerable. If you can't work from home, you're advised to not work. So you wouldn't venture into work, and you would hopefully be eligible for statutory sick pay or employment support allowance. We haven't had the situation over furlough confirmed, but it's fair to say that the last round of furlough did include clinically extremely vulnerable as a reason why you could furlough staff. We just haven't had that confirmed in the guidance. Forgive me if it has come out in the last day and I've missed it. We'll be picking up this next week, as I say, and one of the areas we'll be looking at in greater detail is furlough. A really important link at the bottom of this slide. Please do share it as widely as possible. It is relevant for anybody who falls over 60 and may have any kind of clinical vulnerability, or under 60 and have a clinical vulnerability. Because by registering on the shielding support, like I said, the government is still using a term we've been told not to use, but by registering on that page, it means that you can get priority access to supermarket home deliveries. And that's a really fantastic piece of support that has been recognised as being vital for people who are trying to stay home as much as possible. And the way to get on that list is by registering via the coronavirus shielding support page. So that link at the bottom is a really good one to get out as far and wide as possible. So put it out in your newsletter, make sure that people are aware of it. As I say, clinically extremely vulnerable will be written to, and that will be on there, but not everybody who is over the age of 70, not everybody who may have some vulnerability will necessarily know about it. So get it out as far and wide so that people can get that priority delivery. Keeping people who are vulnerable, particularly vulnerable to COVID-19, out of things like supermarkets is a really great step forward in protecting their health. So knowing about this is a really important thing. My final slide is just highlighting about financial support. And as I say, I haven't gone into detail here about the job retention scheme. It's important to remember the job support scheme won't be kicking in until after we come out of these restrictions. So 2nd of December, which is the first date of review, and hopefully the date that we come out. And if they do it on a tiered approach, it's quite likely that Dorset will come out early from the restrictions if that's what they do at the end. But probably the two things to highlight are, one, that it's more generous than the package is currently, so it's going back to that 80% support. And the second one is that the employers will still need to pay the national insurance and the pensions contribution, which is something they've done in the latter part of the furlough scheme. And there is also some support available. So there is a really good page on the Citizens Advice, which clearly highlights around furlough for employees, and it talks quite well, but quite simply, in simple terms for people to understand if they're eligible and how they might be able to talk to their employer about eligibility. And of course, there are further links, as you'll see there. It's worth highlighting the job support scheme. It says from the 1st of November. Actually, that isn't necessarily correct. We will have to wait and see exactly how that's going to run. But this is directly from the government guidance page, so I left it in because that was the date they specified. But that doesn't feel correct to me, I have to be honest. So although I said that was the final slide, I'd actually forgotten this one. So Joe very kindly shared this morning with me the local support numbers that we had from our previous lockdown. And as I say, all of these will be available. All these slides will be available, so those numbers will be available on there as well. There is quite a lot of local support that can be accessed, and a good point of call is the Volunteer Centre Dorset. So the Volunteer Centre Dorset are really working on a two-pronged approach. One is if you're interested in becoming a volunteer, get in contact with them. And the other is if you feel you'd benefit from having a volunteer, to get in contact with them. So they're a good point of contact when it comes to volunteering. But please support our community by making sure that these essential numbers are out there. And of course, we will be putting these up on our website and making sure that these are as accessible as possible through our e-news and any other messaging that we send out. So I'm going to come off sharing. Okay. So that really is a very quick tour. I do recommend the links on the front sheet because those will give you more in-depth guidance. The links within the slide for the clinically extremely vulnerable will take you to separate guidance, and that's worth looking at as well. If you do have any questions, pop them in the chat. I'll have a little look at them, and what I'll do is I'll make sure that the chat with answers is circulated after this meeting via our website, so that you'll be able to go directly there to see the answers to any of the questions that are posted. And of course, we will use it to work out what we're going to write for our presentation next week. Okay, I'm going to stop there so that I can hand over to Ian to talk about funding support that's available. Thank you, Ian.
Thanks, Paula.
Do you want me to share straight away, Ian?
Yes, please.
Nope.
Yeah.
Here we go.
Yay.
Excellent.
Okay.
Thank you. Seamless transition. Brilliant. Good morning, everybody. Okay, I just wanted to, I'm going to whiz through these slides. I'm right in thinking that they will all be available at the end on the DCA website, so that's great. I just want to go through the Dorset Council Organisational Revenue Support Fund, the ORSF, as we've called it. It's a bit of a mouthful, so apologies everybody for that one. Okay, next slide, please. So just going through this, I've taken some of these slides from a previous webinar, so bear with me. So I'm just going to outline the outcomes-based fund, give you a good explanation about the application process and the funding guidance, key thing explaining about the timelines, and if you've got any questions, then we'll try and answer some questions. But I will whiz through these. Okay, thank you. So the key thing really, the fund went live last Thursday, and it's quite a short turnaround. Apologies for that. It closes on Sunday, the 29th of November, 2020. We will assess through a panel. So we've got some experts on funding and the sector who will meet around about the middle of December. And then we were looking at getting in principle decisions out to applicants around about just before Christmas, so probably about the 19th, 20th of December. But obviously that it might vary a day or so. But that's when we'll be looking to inform people. Okay, next slide, thank you. So in terms of where we are now, without going into lots of detail, the Dorset Council went through a public consultation process. and the main aim was to secure and maintain levels of funding that organisations had previously been used to in the sectors. So you'll see in the top bit there, we're looking at voluntary community sector, community centres and village halls, museums, heritage, arts and play. Okay, so I'm just going to talk about the voluntary community sector really. What we want to make sure is that, you know, we want to try and support those organisations that have previously had some revenue support through the previous sovereign councils. They have had service level agreements, and we've basically pulled these all together into one fund. So there will be only one round each year, and it will grant 1 to 3 years of revenue support agreements to cultural and community organisations who essentially deliver services that support our council's 5 corporate priorities. So you don't need to meet every corporate priority, and we'll go on to those in a moment, but that's the real focus. We're looking for organisations to work with us to support our corporate priorities. Those that perhaps sadly that might be unsuccessful in this particular round, we're looking at another opportunity for project funding around about February next year. So if you're not successful this time around, there is an opportunity for another fund. But the thing to mention is both this fund and the fund in February, we are looking for the funding to commence from April 2021. Okay, next slide, please. So who's eligible for the funding? So the new Organisational Support Revenue Fund will replace all historic revenue agreements with a brand new application and award process. So recipients of historic funding agreement and other Dorset-based voluntary community services and cultural service organisations that meet all the criteria can apply to this fund. Okay, next slide, please. $50 million question. How much can you apply for? Well, in terms of social voluntary community sector organisations, if you've got a turnover of less than £300,000 per annum, you can apply. We will consider applications from organisations who have up to £500,000 in turnover and income in exceptional cases. In terms of how much you can apply for revenue funding. So I keep coming back to that word revenue, for between £5,000 and £10,000 per annum. Again, £25,000 per annum for exceptional applications. Okay, so if you were looking at £5,000 for each of those 3 years, then you would be applying, for example, for £15,000 revenue funding over the 3 years. And we have adopted a slightly different approach where we've gone away from short-term one-off funding in this particular fund to a little bit more medium term, because we want to be giving organisations an opportunity to be more sustainable. Okay, thank you. Next slide, please. What can we apply for? What I would say is that there's a lot more information on the guidance on the Dorset for You, Dorset Council website, but essentially, and this is the key thing, it's core revenue costs. So this is not about this particular fund. This is not about funding activities or delivering projects. That's not what this is about. It's about contributions towards rent, rates and utilities, could be salary costs, insurance for your organisation, and it could also include staff, workforce training and volunteer expenses. All grants awarded for revenue support will be for 1 to 3 years. So it might actually be that you're not applying for 3 years, you're applying for just 1 or 2 years, but the maximum is 3 years revenue support that you can apply for. Okay, thank you. Next slide, please. Core criteria, highlighted in green really. I'll sort of whiz through this. You need to make sure that you have a social impact and that you're improving the health and well-being to the community through skills development and engagement opportunities. We want to see how you use data collection methods and be able to evidence that a range of Dorset residents will have participated in your activities. We also want to see that you've considered how to assess and address your environmental impact, and ideally have developed an environmental policy. Some organisations will be venue-based, and we also want to make sure that if you're going to deliver your service and we're going to give you revenue funding, we want to see that you have at least 5 years security of tenure. Thank you. Next slide, please. Some of you may or may not have seen this. This is the wheel, as we call it, in the council. These are our Dorset Council corporate priorities. Within the online application, you need to meet at least one of these, and you will see the headings there. I won't go through every heading, but you will see that climate and ecological emergency underpin all of those. I would imagine most applicants that are sat in on this webinar this morning would be looking at staying safe and well, or strong, healthy communities. I would imagine those would be the most prominent ones that would apply to you, but you have to meet at least one. Okay, next slide, please. So what will we ask you for? Well, there's quite a lot of supporting documentation that we're going to be asking applicants to provide. You will probably look at it and think, goodness, that's quite a lot of information that you're asking us to provide with our application. It's quite simple that we want to adopt a more robust and business-like approach with this funding going forwards. And again, I think it's relevant to say that because we're looking at potentially funding organisations for up to 3 years, we do require a little bit more information now from those who are seeking funding. So we will want 2 years of accounts and copies of your last 3 bank statements. We want to see a business plan detailing forward plans up to at least 2024. We also want to see a really strong track record of fundraising and income generation over the last 3 years. So we want to see that applicants are not sort of existing on a single funding stream. So the sorts of policies that we'll be looking at, they're quite self-explanatory: GDPR policy, safeguarding, equality, an environmental policy or statement, volunteer policy, so organisations offering volunteering opportunities must have a volunteer policy, and public liability insurance for 5 million. Okay, I'm going to rush through these next here. We want to look at support organisations that are helping support those members of residents of Dorset Council who have protected characteristics. So that slide is fairly self-explanatory. And also that includes carers as well by association. Okay, next slide, thank you. The other thing that we're looking for, as evidenced in your application, we recognise that there's a range of other groups and people that may face additional challenges. And we want to sort of make sure that when you're applying that you're considering that, you're supporting rurally isolated populations, communities, people on low incomes or in poverty, single parents. Could also be people with a military background and their families, and also gender identity. So those are our Dorset Council local characteristics that we will be looking for evidence that you're supporting as your sort of target audiences. Additional criteria for social volunteering community services. It's really key. You need to show the need for your service. And I can't emphasize that enough. So you need to show how you're addressing the ongoing needs of vulnerable people to ensure that their health and well-being is being maintained and they have independence in the community. We need to make sure that you're looking to help us reduce health inequalities and those in high risk categories. And you need to show how your activities will relieve pressure on local statutory services. So how are you going to work with the council and other partners to help relieve pressure on services. And we need to show how you're really addressing the needs of disadvantaged, underserved and marginalised communities within the Dorset Council area. So those are really key audiences, if you like, that we're looking for in your application. Thank you. Next slide. What we will not fund: unincorporated groups or new and emerging groups. Capital items, fairly self-explanatory there. So we're not going to cover ongoing repairs, routine maintenance, refurbishment to buildings. So new roofs, new landscaping. And unfortunately, that will include some of you in village halls and community venues. IT equipment for personal use, not included. But if you need it as part of what you do as an organisation, then you can include that. Vehicle costs are not included. Loss of income is the bigger one. We've already had a couple of inquiries about the fund, and they've both been looking for loss of income. We will not fund that, unfortunately. Core business or activities and services that fall outside of the Dorset Council area. So that's absolutely key. This fund is for organisations that operate and deliver services that target residents in the Dorset Council area only. Okay, next slide. I think I've got a couple of moments left. So what do you need to do? Well, the first, and what I would say to you is you really need to spend some time having a look at the criteria and guidance notes. Seek advice on your application if required. So DCA are very kindly offered to support any organisations with an initial conversation if you need some support to see if your application is up together. It is an online application process. It's quite simple to fill out the application form. If I can do it, anybody can do it, but it is online. There are no paper applications, I'm afraid. And you've got the web link there to access the fund. There's very, very comprehensive guidance on our website. And also when you're filling in the application form, there are a number of prompts on certain questions. So if you hover over some of the questions, it will give you a really good explanation of what we're asking you to provide us with. Okay, next slide. So how do we apply? I've just said you apply online. Successful applicants will be granted a funding agreement for 1 to 3 years from the 1st of April 21. So that's the key thing. This is about funding that if you're successful, you will receive funding from the 1st of April next year. It's not from January until April, it's from the 1st of April. As I've mentioned, just very quickly, unsuccessful applicants who meet the eligibility criteria will be able to apply for a smaller 1-year grant, which we're looking at between £1,000 and £10,000 through Fund 2, which is probably going to be a development and projects fund. That fund will launch around the 1st of February 2021. That fund will be for, we think, for activities and projects, which is very different to this current fund that is now open. The only caveat on that is that obviously we're now going into lockdown. The criteria of that fund may change slightly depending where we are with the pandemic and what's happening in the local area. So we're hoping to launch that, but it could be subject to change. Okay, next slide. So for more information, if you're a cultural organisation, you can contact the Arts Development Company. If you're a voluntary community sector organisation, which most of you on the call today, webinar today will be, you can give Dorset Community Action a call. If you want to speak to myself or my colleague Fiona Thomas, you can send us an email and we will have a chat with you about your project and give you a little bit of a heads up on whether we think you're eligible or not. But I can't stress enough, please do read the guidance before you apply. There will also be a document on the web page, which isn't quite on there at the moment, that will tell you what the headings from the online form will be and what the questions will be. So rather than going into each section blind, that will give you an indication of what to expect to have to answer and put in your application form. So that will help you as well. Okay, thank you very much.
Thank you, Ian. And as you said, those slides will be available on our website with all the links intact so that you can find out more information. But you can go back over the slides if you need to, and you've got all of the contact details should you need more information. So thank you, and we really appreciate that. It is a very tight deadline. It is worth having a look at. If you previously received funding from a district council or from the council, remember that you may well be eligible as long as you meet all of the criteria, and it's definitely worth going back and having a look at. Lovely. Thank you very much. I'm going to hand over to Vicky. Vicky, you've been incredibly patient. Poor Vicky, when we booked this, which was several months ago, we had no idea we'd be starting the session with government guidance on lockdown. So thank you for your patience. And with no further ado, I'll hand over.
It's my turn to share screen now, so let me just see if I can get this to work. Bear with me a sec. Everyone see my slide? Paula, can you give me a little thumbs up? Brilliant. Okay. Right. Good morning. Good morning. Is it afternoon now? Sorry. Good afternoon, everyone. Where's the day going? My name's Vicky, and I'm from Volunteer Centre Dorset. So I'm going to give you a quick presentation about why volunteering in winter is important. I'm going to give you a quick overview of what we do at Volunteer Centre Dorset. Most of you will know this, but for those that don't, it might be something there you hadn't thought of. Looking a bit about what is loneliness, and why loneliness is more apparent in winter. What is it about this time of year that makes it more prevalent? Talk to you about Christmas and winter. Start getting some thinking cap ideas going there. What roles are different for volunteers in winter? And how to volunteer safely in winter, and then where we're going to go next from there. So, Volunteer Centre Dorset. We support volunteers and charitable organisations across Dorset, and we're passionate about all things volunteering. Whether you're an individual looking for a fulfilling role, or if you're an organisation looking for volunteers, we're here to help. We do believe that there's a volunteering role for everyone, irrespective of your age, background, ability, or health, and we will find the best role that suits you. We love to promote opportunities for all and inspire people in our community to get volunteering. The aim of the Volunteer Centre is to support individuals find the roles and to help them through the roles. We also help organisations gain volunteers and support them in looking after their volunteers. It's not just about recruiting the volunteers, it's retaining them. We do this through training courses and other information support. In addition, we also offer services such as training courses, DBS checks and ID badges. We've also taken on a lot more work since lockdown. We've had over 2,000 volunteers registered through the centre, and we've been placing them with individuals, community groups and specific tasks such as assisting at the household recycling centres, flu clinics, etc. We've been part of the coordinated community response, working in partnership with Dorset Council, Age UK, Dorset Community Action, etc. We've taken over the referrals for the distribution of the emergency food parcels, Dorset Council, and we also handle the general referrals that are coming through for people that are looking for help from a volunteer. This is including the usual prescription collections and food shopping, phone befriending, etc. We've been working with over 180 community groups across Dorset who set up as a result of this pandemic. We're in awe of the work all the groups have been doing and want to do what we can to support this by being a point of contact for any questions and help recruit volunteers. We've also worked in partnership with Dorset Community Action and Help and Kindness to set up the Dorset COVID Community Response Groups Forum. Yes, that is a bit of a mouthful, but it's a great platform for groups to be able to ask each other questions, look for information and support, and help each other through these difficult times. So, working with the council and the community groups has meant that we've been able to identify a lot more of the vulnerable individuals in our community. And it's key to keep this contact and communication going with these individuals, especially now we're going into the winter months. We don't have a magic wand, we can't make everything better, but if we can just help people know that they're thought of and to feel less lonely, then it'd be quite something. What is loneliness? Loneliness is not the same as social isolation. People can be isolated, yet not feel lonely, and people can be surrounded by other people, yet still feel lonely. Loneliness is a subjective feeling about the gap between a person's desired level of social contact and the actual level of social contact. It refers to the perceived quality of the person's relationships. Loneliness is never desired, and lessening these feelings can take a long time. Feelings of loneliness are really personal. Everyone's experience is different. So it's quite hard to actually treat the loneliness because there's no single common cause. The prevention and the treatment can really vary depending on the individual. So what is it about winter that makes loneliness more apparent? Sorry, I forgot to show you this quote. I thought this picture was makes you really think about the loneliness, and this quote: "The most terrible poverty is loneliness and the feeling of being unloved." So in winter, the days are shorter, the nights are longer, the weather's a bit nasty, although you wouldn't believe it today. There's ice, there's mud, there's wet leaves. People might feel it's dangerous to be going out because they don't want to slip and hurt themselves. People are worried about catching winter illnesses such as colds and flu, let alone the additional risk at the moment, obviously, of the coronavirus. The cold weather also has an impact on medical conditions like arthritis. Another reason people just want to stay indoors and feel warm. The lack of sunshine has a real impact on some people mentally. The seasonal affective disorder. People, they get dark and they just want to go home and they want to stay inside where the lights are on and it's warm. There are additional worries at this time of year, like the cost of heating, having to buy Christmas presents, etc. Some people can feel really alone in having to go through this. And the last one is people see this time of year as like a celebrationary season. If you don't have anyone to celebrate with, it can feel incredibly lonely. So there are 51 days until Christmas. Sorry for those of you, that's a bit daunting, but I thought I'd look it up just to find out for us. Lockdown, social isolating, and keeping safe to combat the coronavirus means that Christmas this year is going to be very different for each and every one of us. As much as it's tempting to ignore the rules and the guidelines, they are there to keep us all safe. We can get through one Christmas if it means we can all be together for many more Christmases to come. We also find a lot of people who are lonely actually come forward to volunteer at Christmas. By helping others, it helps them not to feel alone. And with most Christmas events already cancelled, carol concerts, festive lunches, Christmas markets, office parties, etc., we need to put our heads together at a safe distance to come up with ideas on how we can support each other through this festive period and the winter. Next slide, I've got a few ideas for people to start be thinking of, or things that I've read about on Facebook that are already happening that could be ways we can look at addressing this. We could work with some local schools, see if we can get children to write cards and letters. You can deliver them to care homes, neighbours, people that live on their own. You can work with local businesses and donations to make hampers for people who are on their own. You could give these to NHS workers, blue light workers, etc. You can speak to local craft groups to see if there's anything they can make of a festive nature. Again, this can be given to people who are in hospital over Christmas, or if they're living on their own. You can create a Christmas card chain and ask each house on a road to give a card to the next house along. This is one that's quite interesting, is work with the digital champions to identify people who could benefit from the guidance on technology so they can actually contact their loved ones, even if it is via a video call. You can offer a chair at your dining table, obviously not this month with lockdown. It will depend on guidelines. But you can make a meal for a neighbour. If you're making a batch of mince pies, give an extra few to the person next door. As simple as that. This virtual carol singing, seeing a lot of this happening when people can join via Zoom or Teams and sing along, or a group can do some pre-recorded carols and share them with the community. We can do some doorstep carol singing, not quite the same as the clap for carers on the Thursday night, but people could all stand at the doorstep on the street and sing together. You can create some virtual Christmas events, how everyone make Christmas cakes together online or make mince pies. I have to do that every year with my mum online this year because we make mince pies together. You could create a regular email or a newsletter with some Christmas stories, some jokes, some puzzles, some Christmas craft ideas. You could look at establishing twinning projects. We thought an example would be between a school and a care home so that the letters and the cards could be exchanged both ways. So the care homes could write to the students and vice versa, build a bit of relationships there. And Volunteer Centre Dorset is working with other agencies on a Christmas volunteer programme, which we're hoping is going to be formalised shortly. The plan is to keep it neighbourly and to work with volunteers and the community groups on this. If you'd like to hear more about this programme, there'll be a link going up in the chat shortly that if you could register your interest on so we could keep you informed, then that would be great. So what roles are there for volunteers in winter? Well, the newest one that we saw come about was help with the flu clinics. And whilst most of these have already taken place, there are some that are still running. And this has just been going along more to do, I guess you could say, crowd control, but it's telling people where to go, it's explaining the process, encouraging people to wash their hands when they're going into the clinics, that kind of thing. Have to put down the Christmas activities. Regardless of what we're going to be doing over this Christmas, there are going to be need for volunteers to go help with this. And then there's the usual really important ones of prescription collections, food shopping and phone befriending. Again, as Paul has already talked about, the change in guidance for the new lockdown, we're going to expect to see an increase of need for these. How do you volunteer safely in winter? A lot of these are steps that you should be following regardless of the season. You should only volunteer if you feel well enough and you're not self-isolating. Again, keep washing your hands often for at least 20 seconds. Follow the rule of staying at least 2 meters apart, about 3 steps. And if 2 meters isn't possible, stay at least the 1 meter with precautions. Stay outside of people's homes. Try and plan your volunteering during the daylight hours and always tell someone where you're going or what time you anticipate being back. I got told off for this the other day because I didn't tell my partner when I was coming back and he phoned me. Make allowances for winter weather. So, your journey might take a bit longer and, allow time for potential disruptions. And to make sure that you and your car are equipped for the winter weather. Make sure your levels are topped up. You've got your de-icer, you have a torch. Your safety and your health and well-being are just as important as the people that you're supporting. Now, I know that Paula has covered most of this in detail, but I just wanted to share the guidance that we've had come out to us from the NCVO, which is the National Council of Voluntary Organisations. New restrictions come into effect in England, and that's at 1 minute past midnight tomorrow morning. That's not at the end of Thursday, it's from tomorrow morning. And where possible, people should volunteer from home. If you can't do so, if you do have to volunteer from outside of your home, you need to follow the social distance guidance, and that no one in your household has symptoms or have tested positive for coronavirus. Voluntary and charitable activities are exempt from a number of the new restrictions. And this means that where groups are able to volunteer outside of their home, they can meet in groups of any size, indoors or outdoors whilst volunteering, or travel to volunteering or while volunteering. It should always be a volunteer's personal choice whether they wish to volunteer, if it's inside or outside of their home. So don't pressure your volunteers. If they don't feel comfortable, it's their choice not to do a role. Volunteer involving organisations must ensure that your workplaces meet coronavirus safety standards. People over the age of 60 and those who are clinically vulnerable do not face any specific restrictions on volunteering, but should follow the same guidelines. However, as this group could be considered at a higher risk of severe illness from coronavirus, they may need additional support to follow to social distancing rules and minimise contact with others. There's a further group of people who are defined, as Paula set out earlier, as the clinically extremely vulnerable, which means that they are more prone potentially to the coronavirus. They've got a specific serious health condition which could lead them to be more impacted by it. Clinically extremely vulnerable people still can volunteer from their home, but they are advised not to volunteer outside of their home. Existing government guidelines, again, are being updated on a very regular basis. We're expecting more announcements this week as things go through today. So it's really important to keep up to date on the rules. So what are the next steps? Mentioned earlier, the Community Response Groups platform, which is the platform that's been set up with Dorset Community Action and Helping Kindness. We're going to be putting a thread on there to look at ideas for the winter period, things that are happening over Christmas. So please go on there, register, tell us what you're up to, if you've got any ideas or if there's any help that you need with an idea. there's also a section on there that we are keeping it updated as new information is coming out from Dorset Council and the government. So the groups have got somewhere to go to get information. At the Volunteer Centre, we're reviewing and updating our guidance to make sure that it's current with the new guidelines that are coming out. And we're also looking at our training offer at the moment. It's something that we haven't been able to give the attention that we'd like to in view of the volume of work we've had. We're looking at setting up some online training and some bite-sized learning sessions, but we'll give you more details on those as they come about. There's some useful links on here, the link to our website and the links to some other sites that might be useful to help you with some information. So our contact details. We have a very lovely social media guru in our team called Izzy that keeps our Twitter and our Facebook and our Instagram accounts up to date. Please do follow us there to see what's going on. I'm not just saying that because she's on this meeting at all. And this is the last thing to say. Yeah, Paula, yeah, easy. Yeah, last thing I want to say is a thank you. What the work the community groups have done, it humbles me every day, the amount of support that's been given to the communities and the volunteers that have come forward. Just thank you for everything you're doing. Thank you for keep doing it. And we are here to help you and support you in any way that we can. I'm going to stop sharing now because I don't mind looking at the white screen. So just bear with me there. And I shall hand back to Paula, I think. Right.
Vicky, thank you so much. I mean, there's a lot of food for thought. I know that there's been a lot of conversations about how volunteers will be used during this new lockdown, as a lot of the restrictions from the first lockdown where we needed people to, you know, protect people that were shielded aren't going to be quite so critical. But I think what you've highlighted there is that as we move into the winter months, COVID or no COVID, it's an incredibly challenging season for people. And the groups that have now been formed, really working at that micro level, right down into villages and serious place-based support was never more needed. And it's really important that we know who you are so that we can connect you to all the support that is available and the latest guidance. And the forum that Vicky, that you mentioned, is particularly critical to this. I don't know whether it's worth just mentioning, if there are community groups that aren't currently on the forum, the best way to get in contact.
Yeah, if you want to just email me, I'll put my email address up in the chat and I can give you a login and a password. But it's a relatively new forum. We've been running it for a couple of months now. But it is a platform, it's a message-based platform system that people could go on there and ask each other questions, or and it's also volunteer centres on it, DCA's on it, Dorset Council have got a login, the Dorset Race Equality I've got a login. So if there's a question that comes up, you've got people on there that can help you, or if they can't, they know someone who can. So it's all about this solidarity across the county, because everybody's working in their community group, which is fabulous, but you might come across something that you don't know how to deal yet. A group in Ferndown might have an idea for an issue that a group in Lyme are having. And it's just about sharing that feeling. It's about, and again, it's creating a community across the county for the groups, because you've all done such fabulous jobs, and we just want to do all we can to keep that going and go from there.
Thank you, Vicky. So yes, please just drop us a line either to Dorset Community Action or to the Volunteer Centre if you have an interest in joining the forum, and we will get the details out to you. It is an inclusive environment, not exclusive. So the more the merrier. It's about keeping each other in contact and also keeping you in contact with guidance, and also importantly, funding updates and things that will help your sustainability. If you are looking at sustainability moving forward, please do remember us at DCA as well, and that we can support you, whether you're a new startup, a group of friends who got together to support, or you're an established group. Lovely. I'm going to hand over to Joe, who's going to just do a quick roundup of the latest funding. This information, again, will be available on our website, and it will also go out in our e-news. Hopefully people have been receiving our new look e-newsletter, which is much more interactive. And I need to do our own little clap there for Ray, I think. If you haven't clicked through, if you've received the email and you think it's just our, boring old e-bulletin, then please do click through, because you're in for a really nice treat. And it is a real sit down with a cup of tea and just flick through latest guidance, latest links, latest news. And we also want desperately as many good news stories as possible from people, because actually there's nothing nicer than when you sit down for that coffee break to just actually take a moment to celebrate some of the things that Vicky was talking about, because there's a lot of bad news out there. So please share your good news stories with us so that we can promote some of the amazing things that are going on by community groups in Dorset. So thank you. So please do click on. And I'm really sorry to the rest of the team that I described e-bulletin as boring. It wasn't. It was fantastic. But it's even better. Have I just dug myself a hole? I think so. I'm going to dig out really quick. Jo, could you talk about funding, please?
Excellent. The other thing I would like to add, as far as people adding photograph stories, is that we would like photographs to go with the stories as well, to make it really colourful, particularly as we're coming up to Christmas. So the funding date for 3rd of November, which is today. Can we go on to the next slide, please? We've already talked, well, Ian has already kindly talked about the Dorset Council Operational Support Revenue Fund, so don't need to worry about going back through that again. Dorset Community Foundation have got the Wessex Water Recovery Fund, and that's definitely worth looking at. It's one that we didn't know existed until about a week or so ago, but good source for small capital items or general running costs. But you will need to make sure that you link with recovery from coronavirus. Another good one is the Neighbourhood Fund, and this is for general social issues addressing disadvantage. Doesn't need to be COVID linked. So that's another one. It's up to £5,000. So please have a look at that. Next slide, please. The Peter Sowerby Foundation Digital Good Causes Grants. They're all really snappy titles, aren't they? We will put these links and slides up on the website, because I don't expect you to remember all of this. Grants are up to £25,000 for smaller UK charities working in areas of arts conservation, horticulture, disability, environment and healthcare innovation, mental health and young people. And this is to help you transform your service provision through the digital development. And of course, we're all having to do this at the moment, what with Zoom meetings and contacting online. The application deadline is coming up fast. It's on Monday, the 16th of November at 5 o'clock. So if you do want to go for that, you do need to be looking at that very seriously now. Next slide, please. Dorset Community Foundation is doing their phase 3 of their Dorset Coronavirus Community Fund. And that pretty much says, as it is on the pot. I can't remember how much you can apply up to. Hopefully somebody else might be able to help with that one and put the amount in the chat. Then the Surviving Winter Grants of £200. This is where Dorset Community Foundation asks people that are wealthy and don't really need their Surviving Winter Grants from the government to donate it to Dorset Community Foundation. And that money is then given to people who are experiencing fuel poverty in Dorset and Bournemouth, Christchurch and Poole. And it's last year they raised over £20,000. So many people benefited from this. The Trust House Charitable Foundation is opening soon. That's small grants with a focus on community support, and that reopens on the 12th of October. And then the major grants, which focus on family support, reopen on the 9th of November. Charities Aid COVID-19 Resilience Fund, they are still coming in, these COVID-19 funds. This is a new 20 million grants, offering grants between 10,000 and 100,000. And this is to support communities who are hardest hit by COVID-19. Next slide, please. The Dorset Leisure Development Fund is open for applications at the moment, and the deadline for that is the 31st of December. And that's for fairly small amounts of money, but definitely worth looking at. Garfield Weston is a very popular fund. That's just announced a £25 million fund to help cultural organisations recover from the COVID-19 pandemic. Comic Relief, they're all coming in, aren't they, at the moment? They've got grants up to £4,000 for small local grassroots organisations in England to help, again, recover from the impact of the coronavirus pandemic and to make sure that they're providing essential services in the community. Now, this is a lovely one. This is the Architectural Heritage Fund, and this has funding available for charitable groups who would like to reuse historic or vacant buildings in town centres to create new community facilities. And they can fund viability works, so that's the surveys to make sure that the building can be made fit for purpose to be reused, project costs and capital works. And they've also got a crowdfunding match funding scheme and cultural recovery fund. Tesco Bags for Help, you all know these when you vote for them with your little counter thing. They're focusing on youth projects at the moment, and that started on the 1st of October 2020. My next slide, please. Sport England return to play. This one, I have to say, is something that we haven't really seen a great deal of, and now it's coming in. And I've heard lots of people say, how do we apply for fund that's going to help us with sports and physical activities? So this is a 5 million community assets fund, which is part of the new 16.5 million return to play. And that's supporting local groups, clubs and grassroots organisations impacted by the disruptions caused by the pandemic. And it's also focusing on tackling inequalities. Grants are between £10,001 and £50,000. And they're available for projects that are ready to start within 6 weeks. So if you've got something that fits that, then you need to be sat down and applying very rapidly. Then we've got a small grants programme, also from Sport England. This is between £300,000 and £10,000, again for not-for-profit voluntary groups, sports clubs, community clubs, registered charities, community interest, social enterprises, not-for-profit and leisure operators operating a single site. So that's another one to look at if you're just looking for a very small amount of money. And do we have another slide? No. Have I finished? I think I've also been cut off as well. A 5-minute warning. Right, that's my lot, folks. And I think it's also down to me, as I have the unmuted microphone, to say thank you ever so much for coming along today. Don't forget that next week we're going to have the brief to make sure that we can give you all the up-to-date details from the government, of which there will be more detail because they're still writing an awful lot of the things as we speak. They've got to debate in the Commons today. Thank you to all of our speakers. Thank you to Ian Wells to talk about the Reorganisation Fund. Thank you to Vicky for talking about volunteering in the winter and Christmas. And please, 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 if you want to find out more about Christmas volunteering, the links are in the chat. And thank you to Paula for giving our guidelines, the national guidelines that have just come out. And thank you to Ray for doing all of our technical things. And thank you again all for coming today. I hope you have a lovely day and a lovely weekend. Goodbye.
Thank you. Bye-bye.